I've been looking at this or putting this video together for about a week or so. I had a patient that came in and, just went through kind of the normal problem solving and, not everything went right, but I was able to kind of write things. And so I wanted to write down kind of the whole patient experience and very typical of pretty much everyone that walks in the door. And I wanted to go through basically what makes an amazing patient experience and then all of the things that could potentially happen that reduces that patient experience. If you think about this, really this one experience or this video is a very small microcosm into what is happening in your practice, okay? And if you are able to make every patient experience or a very high percentage of your patient encounters this crazy, amazing patient experience, you will have so many new patients coming in, so many internal referrals coming into your practice that you literally won't have enough time to do all the dentistry that you need. On the opposite side, if you are missing these things or don't have a system to create this amazing patient experience, you're going to always be struggling to get patients in the door, and you're going to always want more new patients, even though the reason why you're not getting new patients is because you're not creating that initial patient experience, and then people aren't referring their friends, okay? I think that this is why at Open and Affordable we concentrate so much on systems, is because we want to essentially bake into every patient experience little checkpoints or little protocols, systematic protocols that ensure that all of these little points are being touched on and that every little detail is being checked off so that we can always kind of guarantee that very high percentage of an amazing patient experience. So if you look here, so what I've done is I've created a list, and on the left-hand side is the little details practiced systematically equates to a practice that's growing, okay? And then on the opposite side, the lack of those same little details, not practiced systematically, equates to a practice that is shrinking, okay? So if we look at this, let's just kind of go over a high level of what I'm talking about, okay? So I always think about, let's just talk about an imaginary patient who has a toothache, and they're looking to get that fixed, and they're thinking about where am I going to get that done? So first thing is the marketing, branding, and name recognition in order for them to be able to find you, okay? All of those three avenues are ways that people are going to find you. Are they going out to Google? Do you have a website that's easy to find? Does it come up very high on their search? With, maybe did they receive a flyer on their door? And it made them think, oh, yeah, I need to get my teeth fixed. Oh, I'll call these guys. They're actually coming out to my door and they must be local to my area. Branding. Branding is super important. Think about it this way. When you think about getting prescription filled, are you thinking about mom and pop pharmacy or are you thinking about Walgreens, Rite Aid, CVS? You're probably thinking about the larger companies. Why? Because they invest so much into being in front of your face, and essentially when you are looking for medicine, that's the first place that you're going to think, okay? I think the other thing in part of branding would be reputation, okay? So if you think about it, in my era, there was a company called Kmart, and everyone went to Kmart. There was blue light specials, and then, Kmart was okay, but as soon as Walmart came in, everyone was like, well, they have better hours, their store is actually organized, I can find what I need, and the signs are a lot better, And so Walmart just simply took over, and Kmart almost doesn't exist anymore. Why? Branding, reputation, okay? Name recognition, okay? I think another thing too is, does the name of your practice equate to something? Or is it simply just, Jason's.dds? Does that really mean anything? Not as much as a name that equates to someone saying, yeah, this is kind of the place that I want to go to. So it's super important to have name recognition, okay? So obviously on the opposite side of that is, practices that are unfindable. There's practices in 2022 that don't have a website, that aren't on Google. Seems super weird, but it's not crazy uncommon. Maybe the practice is choosing to be out of network for everyone. Well, there's a certain amount of patients who are only going to go to in-network offices, okay? Or no name recognition. Like I said, the private practice that has no name recognition, or even there's a lot of larger corporations that split up their name. Most likely it's because they are afraid of something negative happening, and they definitely don't want to have that one experience or that one bad issue spread like wildfire to their entire organization. So reputation is super important, okay? And I'm going to put that right here, okay? Availability, super important. Think about that toothache. If they get a toothache on a Saturday, can they, if you have two offices to choose from, office A who's open today or office B that's closed, who are you going to go to? You're going to go to the first one. I can't tell you how many patients come in from other offices. They're like, hey, my dentist is closed on Fridays and Saturdays. I couldn't go through the weekend. I'll go ahead and get this tooth fixed from you. Oh, guess what? You guys did a good job. You're close. Hey, I think I'm going to be switching offices, okay? You can see this quite a lot where doctors come out and they start building practices around what the doctor wants instead of building it around what the patient wants, okay? So when you see those offices that are open Monday through Thursday, 9 to 4, what is that? That's the doctor that wants that schedule, okay? And so when that doctor is struggling for new patients, guess what? They need to turn their practice into something that is built for patients, not for the doctor, okay? The other thing too, welcoming environment, okay? It is very, very important that you have all of your staff trained and they have customer service skills, and that you're always tuned in to what they should be saying. Here at Open and Affordable, our saying that we say that the front should be repeating over and over all day long is, how soon can we get you in? Patient calls with a toothache. I don't care. I don't even look at the schedule. I'm just going to say, how soon can we get you in? Why? Because maybe the patient wants to get in right now, which we take walk-ins, but maybe for them soon is next week. But if you say, let me look for an appointment versus, I don't care what my appointments look like, how soon can we get in? Think about that in the medical industry. How often do you hear that from doctor offices? No, dermatologists are scheduled out 3 to 4 months. Everyone is scheduled out 3 to 4 months. So when you say, how soon can we get you in, and you offer them to be able to come in that day, that's amazing for patients, okay? I would say, on the welcoming environment too, is your office set up to have warm colors? Is your office set up to be able to be a situation where patients like, wow, this actually looks good. This looks clean. I'm going to be having my mouth open. I want to be in a safe, clean environment. So those types of things are super important. There's so many offices out there that have never updated their furniture in years. The fronts have never been trained on what kind of dialogues they should use. And unfortunately, those types of things are going to lead to, hey, anything goes, and you're going to get a potential front office person who is going to run your practice even though they don't know what they're saying. So it's super important. I think that bleeds right into the trained staff, okay? If you don't have a training mechanism, if you don't have operating manuals, you're going to be just flying by the seat of your pants. There's going to be no standards. There's going to be no way to judge someone. So you need to make sure that you have operating manuals. And we have operating manuals for every single function of our office. The doctors have an operating manual. The front office has an operating manual. The assistants have operating manuals. The hygienist. Okay. If you train your staff, they're going to know that every person who comes in, every appointment that's scheduled is super important. If not, on the flip side, they're not going to be doing any confirmation calls. Even with operating manuals, we have a hard time getting our fronts to do confirmation calls. Imagine without an operating manual, okay? Essentially, without training mechanisms, no one will know what they're doing. Your office will seem super haphazard. And the sad part is patients get more upset about the lack of organization than they do about clinical dentistry. People don't really know how good your filling is, but they do know when your account isn't correct or it looks unorganized when they walk into the office. So super important, okay? Systematic flow. Super important. Think about when you go into any restaurant, and you've been into some good ones and some bad ones. Is there a systematic flow? Do they get you, seat you? Does the server come to you quickly? Do they get the water out to you quickly? Or do they just sit around and it looks like everyone's bumping into each other and they don't know what's going on? Okay. Again, you need to be super organized with the way that patients flow through your office, okay? Do we know every single appointment type? Do we know the setups for those appointment types? Does everyone know their role? Does everyone know the sequence of what to do within the appointment? Does everyone know their sequence of what the next appointment type is? Those are all super important aspects of getting people to get a systematic flow so the patient feels like everyone knows what they're doing, okay? Asking for referrals as part of the systematic dialogue. Again, we're always looking for new patients. And if a lot of newer doctors are apprehensive on asking for referrals, whereas what we've done at Open and Affordable is we've created as part of the new patient exam to ask for referrals. So the flow is perfect. It's kind of baked into the entire appointment, and it's not invasive or anything like that. And it really actually surprises a lot of new patients that we are looking for new patients. So to ask them if they could send in their friends and family, a lot of them are surprised, like, oh yeah, sounds good. I've got a brother that wanted to get in. We've yielded thousands and thousands of patients by baking that into the system. A lot of practices that I've seen really just hope that more people show up. They don't have this baked into their system, okay? Recall scheduled before starting the procedure. When is the time that patients love the doctor the most? That is before the doctor ever gets into their mouth. So why would you wait until after you do the root canal or after you do that extraction when the patient has gauze in their mouth and they've been sitting there for an hour and they just really want to get out of the office to schedule the recall? Get that done before you ever pick up the burr or ever pick up the handpiece, okay? There's many offices out there that simply hope the patient will come back. The most important thing is to create a bunch of lifelong patients who are always coming back for their oil changes, okay? And I always say this to doctors, you should be more excited about their next cleaning visit than any other visit. I don't care if it's an implant or root canal. We want to have lifelong patients. So get that scheduled. Getting that scheduled before the procedure even starts is amazing. And having all of your assistants trained to look and see if their next recall appointment is scheduled, and have them scheduled before they even come and get the doctor. That's super important, okay? The next thing I can't emphasize enough, which is saying yes to and being super positive about everything and encouraging same-day dentistry. There are so many scenarios where this is what's happening. Okay, Frank, so it looks like we're going to need to get that filling done. So, let's get you scheduled here in the next couple of weeks and we'll get that done. That's the narrative versus this. Hey, Frank, yeah, so we've got a little small cavity here. We can get that done whenever you want. We can get that done today. We can get that done next week, whatever you want to do. And then Frank says, oh, do you have time today? And then some doctors will say, well, let me take a look and see if we have time. Versus some other doctors are like, oh, absolutely. This is going to be the easiest filling I've ever done. I don't even know if I have to get you numb. Going to be in and out 10, 15 minutes. What do you say we get it done today? Can I get that done today for you? And the patient's like, what? That's great. Yeah, let's do that. I can't tell you how much dentistry is done when you are saying yes, you're being super positive about it, you're saying that you can get it done that day. Do people really want to come into a dentist office? No. The fact that they have come through that front door for the first time or that day is crazy, because they've probably been stressing out about it at least that day, but maybe even for a week. And now that they're in, if you can say, listen, let's just get everything taken care of today so that you don't have to go through that stressful week or stressful day. Everyone is so grateful when you do that. So always be super positive and encourage same-day dentistry. Okay? Addressing chief complaints quickly. Okay. Why do patients come in? I think that it's a very simple concept, but some dentists don't understand this. Patients come in wanting to get something fixed. Okay. They actually want to come in and even spend money. So you come in and you address the chief complaint first thing. Okay. Now, they might have other issues, but the problem is that the typical new patient experience in dentistry is this. The patient's going to come in, the doctor's going to take 1,000 x-rays, the x-rays are going to hurt, it's going to gag, it's going to take a long time, and then the doctor's going to come in and come up with a laundry list of 1,000 things that they need to get done, and it's going to cost a lot of money. Instead, and the patient's just like, I hate going in there because I know I've got a lot of stuff I've got to get done, but I just want to get this front tooth fixed, okay? So we go in, and our goal should be to address that chief complaint as quickly as possible. Basically strip down all of that negativity that they've had on that normal patient experience, which is we want to look at only their chief complaint. Yes, we're going to take a panel, so we're going to be able to see other things, but we want to take care of that chief complaint quickly. We can mention some other things, okay? So if I had a chip on number 9, but I had a giant abscess on number 2, I'm going to at least say, hey, Frank, you got this abscess on number 2. Does it bother you? No, it doesn't. Okay, let's get you back in a week or so. We'll go ahead and fix your filling, but I'd like to get you back in a week or so. Let's get you scheduled for your cleaning, and we'll come up with our entire game plan then. We get his chief complaint taken care of. He walks out, let's say it's a $200 charge, whatever, and he's out of the operatory in half an hour. We've basically stripped down all of his main complaints, which is it didn't take too long. They didn't tell me it's going to be thousands and thousands of things I got to get done. They didn't tell me it was going to be thousands and thousands of dollars. And these guys are pretty reasonable. Yeah, I think I am going to come back for my cleaning because that's actually something I wanted to get done too. Okay. So again, if you're not doing that, you're stonewalling patients, you're upcoding and upconverting every appointment, and you're scaring the patients with larger treatment plans. Okay. The next thing is progressive and profound anesthesia, okay? We talk about this a lot, but Your anesthetic technique is super, super important. Why do we take so long in dental school? Because we don't achieve profound anesthesia. And so everything we do, the patient is feeling it, and then we get all stressed out. We give them another quarter of a carpule versus bombing the patient with anesthesia to the point that they are super numb and they don't feel anything, and we can get through the procedure very quickly. Okay, progressive anesthesia, where we start off with just a little bit and then we just give them a little bit more until they cannot feel the pinch of the needle, and then we get them profoundly numb. Okay, again, a lot of dentists out there who don't know the anatomy are using a lot of gizmos, topical, shaking of the lips, all of this kind of stuff because they simply don't know a very simple and profound technique of progressive and profound anesthesia. Okay, making friends, solving problems. Okay, so you need to be able to establish a relationship with your patients so that they trust you. You need to be someone who is empathetic towards them. You need to be someone who understands their clinical and financial concerns, okay? You need to be someone who's not out there searching for non-problematic dentistry. You need to be someone who they would also send their friends to, okay? So we always talk about this, that it's a very important formula of someone with a magnetic personality, or at least has their empathetic nature dialed in, their dialogues dialed in, but also someone who can do amazing dentistry. If you can get those two things dialed in, patients are going to refer all of their friends to you, okay? Breadth of practice, we've talked about this. It is so important that you can do all facets of dentistry, okay? Yes, there are some procedures that are probably best in the specialist hands, but if you're only doing the basics, if you're only doing fillings and you're not being able to get patients out of pain because you just are not comfortable with it and you want to refer all of that out, you're just not going to be the dentist that people say, yep, went into this dentist and they solved my problems, okay? Very few times patients are going to say that a filling is their chief complaint. It's usually other things that you need to be able to do: root canals, extractions, or bigger procedures to get them out of pain, okay? Getting through procedures, again, very important. It's kind of like the breadth of practice. If you are failing to get through procedures, if you have roadblocks, if you mentally can't get past it, if you physically can't do it, patients are going to figure out that you're not able to solve problems. And so they are going to shy away from getting things done. I walk into a lot of practices where there's one doctor who's the preferred doctor and then one doctor who's not the preferred doctor. And everyone's like, I want to be seeing Dr. A instead of Dr. B. Why? Because Dr. A can get through procedures. Patients understand that things hurt sometimes. I've had some patients that are so grateful that I've been able to get them through a root canal, even though it was painful, because they just didn't want to go home in pain. So getting through procedures is super important, okay? A lot of dentists can be scared. It's not going exactly the way they thought, and so they just have a mental block. They feel like they should refer, and then they start referring everything because they're scared. So doctors need to be able to get through patients. Caring about the patients. It is important to have empathy for the patients. We've talked about this before, for their financial or their clinical concerns. If a patient is super apprehensive, you need to be able to find ways to get them through that, either through talking them through it or using some type of a relaxing drug. Most of the time, if you are super careful with the patients and you talk them through it, they will break down those emotional scars. And if you're starting off with super simple procedures and working it up, they gain a relationship with you that they don't really need any of the drugs because they just feel like they're in a safe place, okay? Follow up. So important. There are many malpractice suits that if there was just simply some follow-up, it would have been completely avoided. Patients understand how much you care about them when they get a follow-up appointment that evening or the next day, just simply asking how they were doing. And if things didn't go perfectly, hey, they're willing to forgive you as long as you are wanting to help them out, okay? A lot of times doctors don't do any follow-up and they just say, yep, I'm a doctor, you're a patient, whatever the post-op is, you're just going to have to suffer through it. That is not a welcoming environment, okay? Again, one of the most important things is right here, okay? Asking for feedback all along the way. We have feedback mechanisms inside of Open and Affordable to make sure that we try to get as much feedback, positive and especially negative, on every little one of these steps. And essentially, all of this entire flow, everything in Open and Affordable, was made by patients. We basically said, which is better for the patient, this or this, and we came up with a random idea, and then we tried to get as much feedback from the patients on that particular idea as possible. And if the patient said, you know what, I really would have preferred this, guess what? We tried as much as possible to bake that into the system. Why? We're reducing problems every single time that we can, so that patients, every single version of Open and Affordable in our operating manuals is just better and better and better, and the patient experience is getting better and better and better, okay? So collecting for services. It is super important that the doctor knows what the financial arrangements are before beginning the procedure, and the patients want to know that too. Then when we go to do the procedure, the patients know exactly what the out-of-pocket is going to be, or very close, okay? If you don't have this mechanism going, or if you are stonewalling the patients and saying, let's get you scheduled back because I don't have a pre-auth, or let's wait for the EOB to come back and we'll kind of go after that, you're going to always be chasing money instead of getting that money collected up front for the services that you're going to do. It's really important, especially as your practice gets busy. If you do not know the financial concerns, you're going to be overproducing. You're going to be doing a lot of dentistry that you did not know was free because you didn't know that insurance wasn't going to cover it, or you were hoping that the patient was going to pay when in reality they never were going to pay, okay? Now, all of this kind of comes to the tip of the iceberg, which is, if you are amazing at every single one of these points within every single patient experience, you're going to find out that if a patient has an amazing patient experience, they're going to refer 5 friends to you, okay? If they have a terrible patient experience, they're going to tell 25 of their friends to never go to you. So it's so much more work when you have bad patient experiences, because your practice will shrink faster than if you have good patient experiences, and it'll only grow by 5. So it is imperative that you come up or you follow a system that has these points, and have them all reviewed and updated as much as possible with your staff, so that you can reduce problems and create these amazing patient experiences. And what does this lead to? It just leads to a crazy amount of work that needs to be done. There's too many patients. Everyone wants to get more than you were expecting. Why? Because they trust that you have this amazing patient experience. You've helped out their friends, and they want to get the same smile that their friends have. And then what happens? You have amazing patient experiences. You have way more patients coming in than you can handle. You're making way more money than you ever thought. And then you have to find ways to reduce your own taxes. That's what goes on. And then longer term, you create an empire of passive income. Why? Because you own your own practice. You're super confident on what you can provide, okay? Versus other people are simply just working on their resume. They'll always bounce around because they never worked on their ability to make friends and solve problems, okay? Longer term in your career, as you go to sell at the end of your career, you will have a liquid asset. You will have a building, you will have a practice that looks modern, that feels welcoming, and you'll have a system inside of it that you can offload to the next doctor very easily, because they're going to come in and be like, oh, I don't have to be, the patient experience is built around systems, not the doctor. Okay. And they can come in and they don't have to worry about half of the patients leaving because the patients want to follow the doctor. No, the patients are addicted to the patient experience and not to the doctor. Okay. On the contrary, maybe if you don't do this, you'll never create value. Or a lot of times what I see, and this isn't just dentistry, this is like restaurants, this is all businesses. You create an illiquid asset that unfortunately you almost have to give away at the end of your career, because no one wants to come in and buy an antiquated system. Okay. The conclusion here is this: the only thing that matters is the doctor. I can't tell you this enough. In fact, it's very similar to this. Okay. Let's say that you're a third-year dental student and there's a fourth-year dental student who is basically passing their patient base to you, okay? And the question is and let's say that this fourth-year dental student is basically an A student, okay? And does amazing work and did a lot of dentistry, okay? And then you are inheriting their patient base. And the idea is this: do you think you're going to get straight A's or you're going to get A's on this patient pool because the other person got A's? No, it doesn't make any sense. The same thing with practice valuation. Do you think that because this doctor created this amazing patient pool that it's worth something? No, it's only worth the exact same amount as the incoming doctor. So you as the incoming doctor, it's the only thing that matters. You can start off from nothing and have amazing patient experiences and create these crazy awesome systems, and you create value. So it's important to follow all of these steps. You dictate 100% of your success. There are so many practices that are in the back, in a hole in the wall, that are super successful because they have amazing patient experiences. You do not need to be on the corner in order to be able to have an amazing office, okay? In fact, a lot of brokers will tell you this: there are practices in professional buildings where on one side of the hallway, doctors are doing amazingly, and on the other side of the hallway, doctors are doing terrible. Is it the location? Absolutely not. What is the only thing that's the difference? Is the doctor. So make sure that you follow all of these steps, and all of these steps are built into the open and affordable experience, into the operating manuals, so that the doctor, the assistant, the front, the hygienist are all part of an orchestration that makes an amazing patient experience every single time, or almost every single time, so that your practice can grow every single day instead of shrink every single day. So I'm going to explain a patient experience that I just recently had that I just went through this kind of checkoff list, and so I'll go through it with you to kind of understand where all of those checkpoints kind of happen. Okay, so had a patient, female patient, non-English speaker, show up to my office, and this was her pano. Okay, complaining about pain on the lower right. Wasn't waking her up at night, and you can see larger caries on 31 there. Also larger caries on number 1, but her chief complaint was not 1, it was 31. So I came in, I did a cavity filling, and then she came back a couple of weeks later for her new patient to hygiene visit, complaining that the tooth had now gotten worse and that it was waking her up at night. and I verified that it was number 31, not number 1, and anesthetized her and was able to complete the root canal. Now, when I did anesthetize her, it did take me quite a lot of carpioles to get her numb, but I was finally able to get her numb after about half an hour or so, and was able to complete the root canal. Okay, so I'll add a little bit more details as we go through this checkoff list, but I think the bigger thing here is that, this is a procedure that happens all of the time. Not everything went exactly perfect. And so, but at the end, we got the result, which is what she wanted, which was chief complaint being taken care of and out of pain. And her experience was so positive that her husband and family members got scheduled with us. So, again, how do we turn this typical emergency appointment into a growing practice? Okay. So, first thing, obviously, she found us. How was she able to find us? Well, the patient was in network with United Concordia, okay, and we are an in-network provider for United Concordia, so they found us through the insurance website, okay. So again, branding, name recognition, marketing, and really just being in network for them, okay? That's how the patient came in the door. So again, working on all of those different avenues, trying to put out as wide of a net as possible to bring in as many new patients as possible. Availability. So patient originally scheduled on a Saturday afternoon. How many dentists did she call before she was able to get in with us? I don't know, but I'm assuming there was a lot of dentists that were closed on a Saturday afternoon. We were open and she got in with her concern, okay? Came in, I saw her husband, and her 2 young children sitting on the couch. It was a super welcoming environment. The husband spoke English, and so, we, just welcomed him in and make sure that we got them in just as quickly as possible. What were the words that were said to the husband? How soon can we get you in? Did we say, we can get you in a couple weeks? No, didn't matter. We said, how soon can we get you in? Okay, staff was able to locate her insurance, was able to put all of the information into the patient management system. Okay, the new patient forms were concise. They weren't 10 pages long. There was just enough information that we need for every scenario in dentistry, but not a single line more than that. So patients aren't frustrated that they have to come in and fill out so much new patient paperwork. Okay. Systematic flow. Everyone from the front to the assistant knew what their role was, especially when the appointment turned from an emergency new patient to a filling. Everyone knew their setup. Everyone knew that they needed a consent form. Everyone looked like they knew the part. Again, gives more confidence to the patients, okay? As part of the new patient dialogue, I asked the husband, hey, so how did you hear about us? Guess what? He saw us through the website. Well, you might have seen we're here from 7:30 to 7:30, Monday through Saturday. So, whenever you need us, we're here for you. Again, breaking down barriers. We're always going to be available for you when you have issues like this. And then I just asked him, hey, if you do have a good experience, I would love to see your friends and family. He didn't know that we were taking new patients. He thought maybe it was just a one-off thing that we let his wife come in. He was like, really? Oh, okay. And then he and his kids got scheduled right then and there. So again, practice that's growing. The practice was growing even before we did a procedure. Why? Because we asked for it. We asked for that referral, okay? Then we decided on that first visit that we were going to do that filling, correct? Guess what? Before I picked up the high speed, the patient was already scheduled for their recall visit. When is the time that she likes me the most? Before I've ever touched her, okay? So the patient said, yeah, I've got this pain here. When can we get it done? And I said, listen, I want to get it done right now. I don't want your wife to be in pain. So he asked me at the second visit when she came back in with the pain that was waking her up, hey, so what do you think, doctor, you would do if you were in my shoes? And I told him, hey, I want to keep this tooth if at all possible. I mean, you can do an extraction. It's going to get you out of pain. But if we can keep the tooth and she can be out of pain, I think that's her best situation. By then, after I had gone through the filling visit where I wasn't trying to push the root canal from the get-go, this guy felt like, yeah, this guy just wants what's best for my wife. So he was like, yep, let's go ahead and do the root canal, okay? I knew the financial concerns, the difference between the root canal and the extraction was only $100. So I did what was best for the patient, and truly I would have done the exact same thing on my own wife, okay? Again, addressing the chief complaint quickly. Did I come in there and did I harp on number one that number one needs to be extracted? No, I did alert them that it did need to be extracted, but I wanted to take care of her chief complaint. I got that filling done within 15-20 minutes and she was out the door, okay? Progressive and profound anesthesia. That's what I did during the filling. I gave her a drop underneath the mucosa, gave her more until she was profoundly numb. Now, on the root canal, I needed to go to 6 carpules of lidocaine before she felt numb. But I was able to get her profound anesthesia. When I went in there after carpule 2, she raised her hand saying that she could still feel it. I stopped immediately, gave her more, let it sit, tried it again, nope. Gave her more, let it sit, nope. Gave her more, let it sit. I did not push her through the procedure clinically until I knew that she was completely numb, okay? Now, again, I think that this kind of comes down to getting through procedures. I see a lot of dentists who are not able to get people numb, and then they reschedule patients. I would say 2 to 3 times a year, I'm not able to get patients numb and get them through procedures, okay? So you need to know your anatomy. This is not as important about chemistry. It's more about anatomy. So if you're trying to use all these different anesthetics, it's not as important as being able to know the anatomy and giving the patient a little bit of time for that to soak in, okay? Making friends and solving problems. I was able to get the patient out of pain. I did not push the patient towards that root canal in the first visit because a filling could have fixed the issue. It wasn't waking her up at night at that point. But once it did go into symptomatic irreversible pulpitis, then we did the appropriate thing, which was doing that root canal. Breadth of practice, okay? So when I'm discussing the root canal, the extraction, to me, it's exactly the same. It's literally the same amount of brain power and effort on my portion. And the patient is like, oh, do I have to go somewhere else for the root canal? Nope. Do I have to go somewhere else for the extraction? Nope. I can do either one of them here. Whichever you want to do, I can do it. If I don't have breadth of practice, I would not be able to get that patient out of pain, and I would not be able to be the go-to place for their entire family to go get their dental problems taken care of, okay? Getting through procedures. Again, we talked about the anesthesia. It was super difficult getting her. I was very, very close to getting her on an amoxicillin and getting her back in a couple of days, but I was able to do papilla, IAN, long buccal, infiltration, PDL, until she was able to get numb, okay? Second thing is when I was doing the root canal, I went on the distal and it went to 18 millimeters and then it was a hard stop. And it did not show me on the apex locator that it was patent. Now, many dentists are going to get freaked out about that, take a bunch of x-rays, worry about what's going on. Instead, I moved right along, positive forward motion, went right to the mesiolingual. Guess what? 18 millimeters, hard stop, no patency, same thing. Then when I went on the mesiobuccal, usually if there's a curved canal or if you got blocked out, you're going to at least be able to get into one of those canals. Nope, all of them gave me the exact same reading, 18 millimeters, and instead of me freaking out about it, I was able to just complete the procedure, no working length x-rays. I just worked at that canal for 5 minutes, and when I didn't get past the 18, guess what? I just decided that's where I'm going to go, and you can see the fill here is absolutely adequate on that canal. So again, getting through procedures, not getting stuck, not freaking out, that is super important, okay? Caring about the patient. Yes, the patient, when I was getting her numb for that root canal, she was still feeling it. Did I push her? Did I say, hey, you're just not going to be able to get numb. I'm going to just do the root canal? No way. I made sure the patient was okay during the procedure. I patted her on the shoulder and I gave her time for the anesthesia to set in, okay? Follow up, again, super, super important, okay? Gave her a post-op call the next day. Guess what? She was feeling amazing. How good did she feel that she got a call from the doctor after getting that tougher procedure done, right? No matter how much she thought during the procedure that I was pushing her, afterwards she knew that I just cared about her and I wanted her to feel good, okay? Asking for feedback all along the way. I checked in with her, making sure that everything was going okay. And then I talked with the husband out in the waiting room. Hey, if there's anything that I can do, just don't hesitate to give us a call. We also have feedback signs out at the front office so that anyone that ever has any negative feedback or positive feedback can go in anonymously and give it to us. I also listen to what the assistants say when I walk out of the room. Maybe the patient doesn't like me. Well, guess what? Or something that I'm doing. I can find that out through the assistant because the assistant is a third party there, okay? Collecting for services. We knew what the out-of-pocket was before we started the root canal. We never do any procedure unless we know exactly, the patient knows exactly the difference. And that's why we don't have treatment plan coordinators, because the doctor needs to know, yep, a root canal is $200, the extraction is $100. I am okay doing both. If this were, let's say that this were a tooth that was going to be used on abutment and we can't get it out, and yet a treatment plan coordinator says, yep, we can get the extraction. The patient comes back, yep, we're doing the extraction. And then the doctor has to rediscuss why we need to keep that tooth. That's why the doctor needs to be smart and knows the financial and the clinical one and the same, okay? Tip of the iceberg, okay? We talked about this. Every good patient experience is going to yield 5 new patients. Guess what? The husband already got rescheduled. The 2 kids got rescheduled. So again, being able to get to this point is going to grow the practice, okay? And again, we just talked about, hey, we're creating a bigger dental practice, a busier dental practice, and something where all of these little points were checked off, okay? Even though everything didn't go absolutely perfect during the procedure, guess what? There's all these little backup mechanisms to make sure that we can have the best patient perception of the experience as possible with the follow-up and whatnot, okay? And so again, our conclusion is the doctor is the only thing that matters. You dictate 100% of your success. Work on implementing these systems into every patient experience, and you will have a crazy busy office. It'll be so rewarding because you'll be able to make friends, solve their problems, and then see their friends and family. When their friends and family come in, you don't have to do so much workup to help the patients out because they already trust you. You already know that you help their mother or their sister or their brother. So this system is super magical and allows you to thrive in a super competitive, saturated market.